Welcome to Wall Residence's video-based training for online documentation and electronic health record. In this series, we will focus on a brief introduction to the LARIS system to include provider and backup worker access, and to provide an overview of security and compliance protocols as it relates to access and use of the electronic health record. We will begin by reviewing the definition and purpose of electronic health records. An electronic health record is a digital version of a paper chart. All providers of services that receive insurance monies, including Medicaid, must comply with implementing a certified electronic health record by January 1st, 2015. Because the electronic health record contains protected information, such as treatment, diagnosis, and the like, the HIPAA security rules for access and storage applies. First, the site must be housed behind a secure and encrypted site. Access to the actual site containing the record requires passwords, and only those who are authorized based on a need to know are permitted access to those records. The LARIS system meets the criteria of a secure site. In fact, to meet this standard, they use certified electronic health record technology recognized by the Center for Medicaid and Medicare Services. To meet the requirements for security, it is important for all providers, backup workers, and employees of Wall Residences to re-review and follow the Wall Residences security policy and associated business agreements. In addition to the standard security policy, there are additional security and compliance requirements specific to accessing LARIS. These requirements include: all users will have a unique login name and password to access LARIS online. These usernames and passwords will not be shared with others. For security purposes, access to LARIS is suspended when the user is no longer eligible to view protected information. Eligibility is dependent on the user's need to know, the user being a current and active provider of services to a specific individual or individuals, and who meets criteria for being eligible to bill for services by way of documentation. The provider will notify Wall Residence's operation coordinator or designee immediately when a backup worker is no longer used. Conversely, Wall Residences will notify provider when a backup worker is no longer eligible. The Wall Residence's security officer is notified immediately of unauthorized access to an individual's record. Using another person's login information to complete documentation is considered unauthorized use. Wall Residences has partnered with LARIS Online to host our electronic health record and online documentation system. Other electronic record companies required use of the proprietary forms used for an array of services, most of which do not apply to us. LARIS Online was chosen because it allows Wall Residences to customize the site with our own forms, allowing us the flexibility to create and use what makes sense for the services that we deliver. LARIS Online is a web-based program, meaning that users access the system on any computer, any tablet, or any smartphone that has an internet connection. This allows the flexibility to enter required documents at home or away. While there is no required software to install, there is an optional program that users can download to make forms available offline in the event an internet connection cannot be established. In its simplest terms, the basic structure of LARIS consists of an electronic version of the complete individual record as well as a complete version of the provider record. Some of the documentation is entered into the record by way of an online form, and other documents are completed as a paper form and then are later scanned and uploaded to the electronic record. Access to the individual's records are based on permissions, meaning that access is granted or limited based on the user's need to know. For example, program managers have the highest level of permissions, allowing them to see and enter all of the individual's records and all of the available forms. Providers have mid-level permissions, allowing them to see and enter only the individuals supported in his or her service. The number of forms available for use are those only needed for required documentation. Backup workers have the most restrictions when it comes to the number of forms available for documentation entry. The backup worker can see and enter the records of all the individuals he or she works with. In some cases, a backup worker is hired by several providers. In these situations, the backup worker can see and enter the record of all of the individuals in the services for which they work. As mentioned earlier, some forms in the individual record are completed through the LARIS system. These forms consist of progress notes, incident reports, annual forms, and the person-centered review. Forms that are completed online for the provider record include forms such as the vacation notice, CEU log, and 90-day operating budget. While residences chose to keep some documentation in written format in an effort to assure time-sensitive documents such as the medication administration record were completed as required without the need for an internet connection. Documents such as the MAR, medical appointment form, doctor's orders, and other documentation will be scanned and entered into the record monthly or when attained, depending on the form. In this final section, we will briefly review a demonstration of the system from the provider side and from the backup worker side. In this demonstration, we are using test accounts so that we are not broadcasting protected information. Test provider is the provider, Teresa and Krista are backup workers, and LARIS online test and quality control test are the individuals. We will first start with the provider view. Once the provider logs on, the main page is loaded. The provider simply clicks on the consumer icon to access the record of the assigned individual. By default, the page lists the individuals on the provider's caseload. If the provider wants to see his or her record, simply choose Staff at the top right of the page. Going back to the individuals page, the next step is to open a record by clicking on the magnifying glass next to the individual's name. In the new box, you will notice that a quick fact sheet containing a picture and demographic information is on the left, and a listing of the documents that have been entered into the record is on the right. Of the documents listed, those with a magnifying glass can be opened and viewed. Those without a magnifying glass cannot be viewed. At the top is where you will find access to the forms. After you click on the Add Session, choose a form from the drop-down menu. There are a number of forms to choose from to enter into the record. After selecting a form from the list, such as the person-centered review, choose Continue to open the form. We will review in greater detail in other training videos how to complete and process each form. Accessing provider forms follows the same steps. Choose Staff from the consumer page and click on the magnifying glass to open the record. After adding a session, choose a form from the drop-down menu. Before moving on to the backup worker access, recall how many forms the provider has access to when it comes to viewing a form entered into the record and when it comes to what forms are available online. If you recall, the test provider has 2 hourly workers. Krista only works for the test provider, and Teresa works for several providers. We will begin with Krista. Once logged on, the backup worker will choose the consumer icon to open the list of individuals with whom the backup worker is assigned. Because this worker is only assigned to one provider, the only record that can be seen are the two assigned to the test provider. After opening the individual's record, notice that the backup worker can see what forms have been entered into the record, but cannot open the forms to view them. The backup worker is further restricted to only the online forms necessary to complete his or her work. In this case, the progress note, incident report, and several logs are available. When a backup worker is hired by several providers, as is Teresa, the list of individual records increases to those assigned to all of the providers for whom the backup worker supports. Notice, though, that the same viewing restrictions and limited forms apply. This concludes our brief introduction to security and compliance for electronic health records and the LARIS online system. Please take a few moments to complete the short quiz that follows. As always, thank you for your time and commitment to creating valued lives and meaningful living.